I'm going to palpate the gracilis muscle, which is the most medial of the adductor group. So the first thing I'm going to get my partner to do is create a barrier, please, because the superior attachment for the gracilis is the inferior ramus of the pubis and the ramus of the ischium, which is pretty up close and personal. So the first thing that I'm going to do is I'm going to use the heel of my hand with my fingers pointed superiorly, and I'm going to work my hand in an inferior direction until the heel of my hand is at the pubic tubercles. Then I'm going to replace the heel of my hand with my fingers and come a little bit laterally. And then I'm going to carefully, respecting the boundary, follow the ramus of the pubis down. And also if I continue inferiorly, I'm going to find the ramus of the ischium, but we're going to end right here. The inferior attachment of the gracilis is going to come like a strip just vertically down the medial thigh. It's going to cross the knee, and it actually attaches here on the proximal tibia at the pes anserine tendon. It is going to do a few things. So obviously it's an adductor of the hip, and it also is going to assist in flexion of the knee and also medial rotation of the tibia, okay? So the way we're going to find it is it sits right beside adductor longus. And adductor longus, if you haven't seen that video, you should check it out. It's very easy to find because it's the biggest, ropiest tendon of the adductors. So I'm going to gently and flat lay my hand on the adductor group, and I'm going to get my partner to adduct against resistance. Perfect. And so I can feel the very ropey tendon of the adductor. Thank you. So the gracilis also adducts. So how can I be sure which one is which? Well, the gracilis is the only adductor that actually does not flex the hip. So what I'm going to do here is I'm going to have my partner flex the hip against resistance as well. And I can feel where the hip flexors end. And what I'm butting up into here with my fingers is the gracilis. Thank you. So now that I know where it is, I can visualize it here. I can sink my fingers more medially into the vertical fibers of the gracilis, and now again ask my partner to adduct. And now I feel the gracilis all the way down here, and it does start to get lost a little bit. Actually, here you can get it. Yeah, and you may be able to follow it all the way down, crossing the knee to the pes anserine tendon.